Hello my wonderful viewer, I want to welcome you to my YouTube channel. If this is your first time of joining, my name is Dr. Chidebeleze. I want to appreciate you for joining me today. On this channel, I discuss about health issues, importance of exercising and other pressing issues within our society. Now today, I'm discussing about how exercising helps in the management of diabetes. I have come to notice that most people that have diabetes don't know that apart from taking your drug, that exercising is another thing that you must do in order to help yourself to prevent the progression of that disease. And also, people that have family history of diabetes don't know that exercising is one thing that you must do in order to prevent yourself from developing this chronic and terrible systemic illness. You must exercise. Now, I want to encourage you to follow me to the end of this discussion so that you can know how exercising does that, and then different forms of exercising that you should do in order to prevent this chronic and terrible illness. I want to also appeal to you to subscribe now to my YouTube channel. Use this time to subscribe. Just subscribe to the go down to the subscription button and subscribe, and turn on your notification that anytime we are going to be placing any videos concerning any health issues, which we normally do weekly on a weekly basis, you'll be able to get our videos. Thank you so much as you do that and join us. Thank you. So for us to understand how exercise helps in the prevention and treatment of diabetes, especially type 2 diabetes, we have to understand what happens in diabetic patients, especially type 2 diabetic patients. Now, they have what is called, in diabetic patients, they have what is called a relative or total lack of insulin. Total lack of insulin. That's what happens in diabetic patients. Now, what is an insulin? Insulin is a biochemical substance which our bodies will require to metabolize glucose. So in diabetic patients, they don't have it, or even if they have it, it is small, a small amount. Then in some of them also, they may have what is called insulin resistance. Insulin resistance. Now, meaning that in these patients, they do not respond very well to insulin. Their bodies, the cells of their bodies, do not respond very well to insulin. So that's what happens in them. Because of that, they now have what is called hyperglycaemia. That is excessive amount of glucose in their system, in their blood, and their cells. Now, how does exercise come in place? How does exercise come in place in these people? Now, you have to understand that there are risk factors for diabetes. For instance, there is a factor that is called non-modifiable risk factor. I was talking about people that have family history of diabetes, whereby maybe the father or the mother or any of the children has diabetes. Then you should know that if any of your family members have diabetes, that you are at risk of developing diabetes. So it is a non-modifiable risk factor for development of diabetes. There is another factor that is called modifiable risk factor, which is obesity. Any of the obesities. So you have what is called a family history as a risk factor, and then you have what is called obesity as also a risk factor. So there are two forms of obesity. I talked about obesity in one of my videos. You have what is called central obesity or truncal obesity. Truncal obesity, and how what is called generalized obesity. So if you have any of these, especially the generalized form of obesity, you are at risk of developing diabetes as well as hypertension. But exercising is like a factor that fights against obesity. So when you exercise fights against obesity. So it decreases obesity, which is a risk factor for developing diabetes. In obese patients, especially in type 2 patients, type 2 DM patients, they have what is called resistance to insulin. So when you exercise, you reduce this risk of obesity, and at the same time, you are also helping yourself by preventing diabetes and also in the treatment of it. I have noticed that most patients that are diabetic, most of them are usually only on their drugs. They are not told to exercise. That is why I'm making this video. Then I want to plead with you that if you are seeing this video for the first time, kindly remember to subscribe to my YouTube channel and then follow me up, turn on your notification button so that anytime I'm going to post any videos concerning health issues, you'll be able to learn more about it. Now, another thing that exercise does, apart from reducing this risk factor, which is obesity here, it does what is called, it amplifies or it increases the sensitivity. Exercise increases the sensitivity of the system to insulin. It increases sensitivity to insulin. So how does it do that? When you exercise, there is a receptor, or there are receptors that respond to insulin. They are called GLUT4 receptors in the peripheral tissues, that is in skeletal muscles. So when you exercise, especially the aerobic form of exercising, that's GLUT4, which is a factor. GLUT4, a factor, and the receptor. In exercising, their number will increase. So when their number increases, the sensitivity to insulin will increase. Thereby, small amount of insulin in the system can help to cause metabolism of glucose to go normal because of exercise, because of increased level of this GLUT4. And then the people that exercise as well, despite the fact that they may not even have insulin in their system, but because of exercising, their tissues will respond to glucose. That is one magic that exercising does. So I am encouraging you to exercise, especially if you know that you have diabetes or you have family history of diabetes. Exercising is one thing that you must not take out of yourself. Whether you have diabetes or not, whether you have family history of diabetes or not, exercising is one thing that can help you to prevent you from developing it. If you have it, exercising is one thing that also helps in the regulation of, because it's going to help your system to regulate and to know how to metabolize glucose very well, despite the inadequate amount of insulin that you have in your system. So I encourage you to exercise henceforth. Now, what type of exercise should you do if you have diabetes? Types of exercise you should do. I have made a video concerning difference of exercise, but because of the essence of this important nature of this topic, the types of exercise you should do, you have two forms of exercising. You have what is called aerobic exercise and static exercise. This is otherwise called dynamic exercise. So the one you should do if you have diabetes is this one, or you have family history of diabetes, or you want to prevent yourself from diabetes, is aerobic or dynamic exercising. So what are the forms of dynamic exercising that you should do? Assuming you want to do that, is running. Running is an example. Jogging is an example. These are two major examples. They have other ones like swimming, like playing football, playing lawn tennis. These are different forms of aerobic exercising that you should do. So I want to encourage you to exercise, and I want you to ask any question concerning the topic of our discussion today, or any question that is of concern to you concerning your health issues. Ask question in the comments section. I will be there to answer you at any time. Thank you so much as you are listening. Thank you so much.